Kidney failure. Symptoms and treatments you need to know. The kidneys are essential organs responsible for filtering waste products and excess fluid from our blood, but sometimes they fail to do this adequately, leading to kidney failure. Unfortunately, untreated kidney failure is serious and life-threatening if left untreated. We will discuss the symptoms and treatments here and provide essential information you should know about kidney failure. Fatigue and weakness are symptoms commonly experienced by individuals living with kidney failure. Their cause stems from decreased production of erythropoietin, an essential hormone responsible for stimulating red blood cell production by kidneys, which has become incompetent at producing sufficient quantities to stimulate them, leading to decreased circulation of red blood cells throughout the body and ultimately leading to kidney failure itself. Red blood cells play an integral part in providing oxygen to tissues and organs throughout our bodies, but when production falls below standard, they cannot deliver, leading to fatigue and weakness, resulting in daily activities becoming challenging or exhausting. If red blood cell production decreases significantly, it could have devastating repercussions for daily activities. Even simple tasks may feel exhausting as oxygen supplies decrease dramatically. Addressing fatigue and weakness associated with kidney failure typically involves managing anemia, one of its many side effects. Medications such as erythropoiesis stimulating agents may be prescribed to boost red blood cell production. Alternatively, blood transfusions may be needed in some instances in order to increase red blood cells within your system. One of the primary functions of kidneys is to filter waste products out of our blood and produce urine. But when kidney failure arises, this crucial process becomes impaired, leading to reduced urine output, known as oliguria in its milder forms or anuria for severe cases. Reduced urine output occurs due to ineffective kidney filters unable to extract waste products and excess fluid from the bloodstream, leaving behind waste products within your system that could result in various health complications. Reducing urine output has multiple implications for those suffering from kidney failure. Toxins and waste products build up within the body can cause symptoms like nausea, vomiting, and an overall feeling of unease. In addition, excess fluid accumulation in the system may result in swelling to ankles, feet, and hands. Anuria, no urine production at all, is an indication of severe kidney impairment that requires immediate medical care to address in order to avoid more complications later. Swelling, medically known as edema, is one of the hallmarks of kidney failure. Kidneys play an essential role in managing body fluid balance. When their function becomes impaired, excess water remains within your system, leading to fluid retention and subsequent swelling. Swelling associated with kidney failure often manifests itself in areas with high water retention, such as ankles, feet, and hands. Accumulated fluid in these regions may cause discomfort and difficulty wearing shoes, as well as engaging in daily activities like wearing footwear or performing daily exercises. Edema in kidney failure results from impaired filtration and excretion of sodium and water by kidneys, leading to excessive accumulation of fluid within tissues, resulting in swelling. An effective approach for dealing with swelling and kidney failure involves addressing its source and taking appropriate actions, including taking diuretics to flush excess fluid out of your system, making dietary modifications to reduce sodium consumption, or monitoring fluid balance. Elevating effective limbs, engaging in moderate physical activity with individual limits, and wearing compression stockings may all help reduce swelling and improve circulation. In more serious cases, such as when swelling affects vital organs directly, dialysis may become necessary in order to remove extra fluid from your system and restore health. Breathing difficulties, medically known as dyspnea, are one of the major symptoms associated with kidney failure. An accumulation of extra fluid known as fluid retention or overload has an immediate impact on lung tissue that leads to breathing difficulty and may make breathing even harder than before. Failure by kidneys to sufficiently excrete fluid results in accumulation in the lungs and can result in pulmonary congestion, which increased pressure placed on blood vessels in order to exchange oxygen and carbon dioxide efficiently, ultimately creating feelings of breathlessness that may make taking deep or full breaths challenging or impossible. Shortness of breath may become noticeable during physical exertion or lying flat when fluid redistributes within the body in these positions and further impairs lung function. This symptom can have significant ramifications on an individual's quality of life by restricting daily activities or creating discomfort. It may significantly impact their quality of life as a whole. Maintaining shortness of breath due to kidney failure requires treating its root cause, fluid overload. Possible solutions could include taking diuretics to aid with removal of excess water from your system and making adjustments in fluid intake or sodium consumption, as well as dialysis treatment to restore fluid balance. Nausea and vomiting are frequently experienced by individuals suffering from kidney failure. These symptoms stem from waste products accumulating in their bodies which the kidneys cannot filter out effectively. When this builds up, your body responds by activating your vomiting reflex in an attempt to expel these substances through vomiting. When kidney fails, waste products like urea and creatinine build up in the bloodstream, irritating stomach lining and leading to nausea. In response, this causes your stomach to feel upset, causing vomiting as an effort by your body to rid itself of these harmful toxins. Nausea and vomiting caused by kidney failure can have devastating repercussions for quality of life and nutritional status. Persistent vomiting may lead to dehydration, electrolyte imbalances, and weight loss, as well as contributing to a loss of appetite and reduced intake of essential nutrients. Changes to urine appearance are one of the best indicators of potential kidney damage for those living with kidney failure. While urine should normally appear clear and pale yellow in appearance, any deviation in its color, consistency, or presence of blood could indicate deeper issues within the bodies that need attention. Foamy urine may signal proteinuria. When kidneys fail, proteins can leak out into the urine and appear foamy or frothy due to reduced filtering capabilities, leading to this condition being known as proteinuria. When damaged or not functioning correctly, kidney filters protein from blood leaking out onto urine surfaces, leading its appearance as foamy or foamy urine. Dark urine could be indicative of concentrated or excessively produced urine or of the presence of bilirubin, a yellow pigment producing during red blood cell breakdown, as a sign that your kidneys have difficulty managing water and waste products properly, leading to concentrated urine output and accumulation. Furthermore, kidney diseases cause renal dysfunction, which in turn contributes to more concentrated urine output. Further accumulated waste products can also darken its hue, making your urine appear darker overall. Dialysis is an essential treatment option in managing kidney failure. Dialysis works as an artificial kidney by clearing away waste products, extra fluid, and toxins from your bloodstream, and there are two primary forms: hemodialysis and peritoneal dialysis. Hemodialysis utilizes an artificial kidney called a dialysizer or dialysizer machine, diverting patient bloodstream through it before filtering through a semi-permeable membrane to filter waste products and excess fluid out while simultaneously keeping red blood cells and proteins within. Once cleansed, this blood is returned back into their bodies, typically occurring either within hospitals or dialysis centers and lasting several hours per session. Peritoneal dialysis relies on using the body's own peritoneum membrane that lines the abdominal cavity as its filter system to remove waste products and excess fluid through diffusion and osmosis processes. Treatment sessions may take place both inside the home or at an outside facility, with regular exchanges of dialysis solution throughout the day, allowing greater independence for patients and greater flexibility for caregivers alike. Both hemodialysis and peritoneal dialysis can provide effective ways of maintaining fluid and electrolyte balance, eliminating waste products, and controlling blood pressure among individuals with kidney failure. Which method would best fit each person will depend on various factors, including medical condition, lifestyle preferences, and any advice from healthcare teams. Kidney transplant is often considered the optimal treatment solution for individuals experiencing kidney failure, as this procedure entails surgically replacing their failed organ with one from either a living donor or a deceased donor. Kidney transplantation offers significant improvement to quality of life and long-term survival over dialysis treatments such as dialysis. However, kidney transplantation success rests upon two crucial challenges: finding an acceptable donor and controlling one's body's immune reaction against it. Donor compatibility can be determined based on factors like blood type, tissue match compatibility, or presence of antibodies. Searching for such individuals may involve extensive tests and evaluation. Once transplantation occurs, a recipient's immune system recognizes a transplanted kidney as foreign and could produce an immune response against it, potentially leading to rejection. To combat this risk and to avoid this unpleasant consequence of transplanting organs into other people's bodies, individuals undergoing kidney transplant require lifelong immunosuppressant medication that suppress their immune systems in order to stop attacking it, although such drugs increase infection risks and cause other potential side effects. Although kidney transplantation poses considerable obstacles, its rewards far outweigh them. Improved kidney function, freedom from dialysis treatment, and overall improved quality of life for transplant recipients. Transplant recipients must remain closely monitored by healthcare professionals, as well as adhere to an intensive medication regime in order to preserve the longevity and viability of the transplanted kidney. Medication plays an integral part in managing kidney failure, from alleviating symptoms to treating complications associated with the condition. Different medications may be prescribed depending on the individual's specific needs and stage of kidney failure. One common medication prescribed to manage blood pressure is angiotensin converting enzyme inhibitors or angiotensin receptor blockers, ARBs, to control high blood pressure, hypertension. Hypertension is often the result of kidney failure. Medications like angiotensin receptor blockers, ARBs, may help produce kidneys by helping control hypertension. Anemia, defined by low levels of red blood cells, is commonly encountered among kidney failure patients. Erythropoiesis-stimulating agents, ESAs, may help stimulate red blood cell production to manage anemia effectively. To maintain mineral and electrolyte balance, medications called phosphate binders may be prescribed in order to control high phosphorus levels in blood, an effect which often comes as a part of kidney failure treatment.